Go ahead.
So today we're going to talk about some different types of wheelchairs and some of the items on the wheelchair itself. Your first wheelchair is just a standard wheelchair. This is the one that you're going to see in most of your nursing homes, and it can be on this cloth back, you know, where the seat is and the back is actually a cloth, or it can be this leather type as well. But this is just a standard wheelchair for an average normal person. I've got the dimensions on your handout for this. This chair actually has elevated leg rests. So if they had a total knee replacement or something like that and they needed to elevate their leg, they can do that, okay? In order to lower this, hold their leg and just push towards the chair and it will go down, okay? This chair right next to it, if you can see the difference, the seat heights are different, okay? This is much lower to the ground, and this is called a Hemi chair. And we use this chair for patients that may have a stroke or a CVA, and they only really have a functioning one side, you know, one leg that's functioning high level or an arm that's functioning high level. So you may see the footrest actually taken off in that case, and the patient is lower to the ground. So this would be the involved side, this would be the uninvolved side, and usually with these types of patients, they may have a flexion synergy with their arm. But what they do in order to get around, gotta unlock the chair, and they use their good extremity to kind of push themselves around. That's why it's closer to the floor. That's why the seat height is closer to the floor, so that they can function with that good leg, okay? This chair over here is called a one-arm drive. Once again, it's for patients that have one good functioning arm. Now the footrests are actually taken off this chair, but this chair can be managed with just one arm, okay? So you have two hand rims on one side. If you push backward on one, you're gonna turn. If you push forward, well, actually you have to do it simultaneously to turn in order to turn from side to side. Or if you push them together, you're gonna go forward. This is not an easy chair to maneuver. So you really have to have a high functioning patient to really use a one-arm drive. This is not a chair you would give to most patients, okay? We have a pediatric chair over here, and this is just, this one doesn't have any hand rims, so the family member would actually be pushing this chair. And the last but not least is this chair right here. This is called a transport chair. It's a lot cheaper than a normal wheelchair, and it's just for those patients that occasionally need a chair. Maybe they're going to the doctor or something like that, and they have a family member that pushes them, okay? Remember, Medicare will buy a chair about once every 5 years. So if you buy a transport chair, if that patient buys a transport chair and they end up needing a regular chair for full time, they're not gonna buy them another one for 5 years. So be very careful on recommending these transport chairs, okay? Okay, I wanna show you just a couple of items on the chair itself. You can see this right here, this is a foot plate, and they will flip up to get out of the way. On the foot plates, sometimes you'll see heel loops, and that's just to keep the foot on that foot plate. Now, this is a heel loop. You can also see toe loops sometimes. And where you'll see toe loops more than anything is if you have a patient that has had a spinal cord injury, and they will cant these forward, these heel plates. Instead of going backwards, they'll cant them forward, and their foot will stay in, you know, that toe loop will prevent that foot from slipping out. And they do that a lot of times with sports chairs in order to get around. and I don't have a sports chair to show you. Okay, so the front wheels are called caster wheels. And this is just a hard rubber caster wheel. And the back wheels are called drive wheels. Okay, and once again, this is just a hard rubber. I have some pneumatic wheels, and that's on these one-arm drive. You can see they're air-filled. And the pneumatic wheels are used for like rougher surface. So if they're in the yard a lot, or they're doing something where they're outside quite a bit, the pneumatic wheels are good for that. It's kind of like the difference between, you know, your regular sports bike and a mountain bike. A mountain bike has these rougher wheels and can tear through areas a little bit easier. The bad thing about pneumatic wheels is they are air-filled, so they can pop. And so that's one thing that you have to consider. It does give an easier ride though. It's a little bit of a softer ride with the pneumatic wheel. These are the armrests. Most of my armrests are desktop armrests, which means it can slide underneath the table. But they are removable. This is a removable desktop arm rest. And so you can put those back in. You can, if you want, switch them around. Most of those you can switch around. So if your patient's having a hard time pushing up from the chair and they can't do a whole lot of shoulder extension, then you can switch these around for them, and they can push up a little bit easier from this type of a chair, from this type of an armrest. I'm sorry. Okay, I want to show you a couple of the locks. This is just a regular toggle lock. And in order to lock this, you're going to push it forward, and you have to make sure that it's fully engaged. Okay? Some of them push forward, some of them push back. It just depends on the function of the patient. Okay? This chair, this pediatric chair, he has extensions on his. Okay? So he's just going to push forward in order to lock, but it is an extension to make things a little bit easier for him. And then he has a chest harness as well, a seat belt and a chest harness in order to keep him in. This reclining wheelchair, we use these reclining wheelchairs many times for those patients that have like a total hip and they don't want them to get in that 90-90 position of the hip and the knee. And so we'll use a reclining wheelchair. This is a semi-reclining. It goes about, oh, maybe it does. No, this is fully reclining, I'm sorry. So it goes completely flat, or you can get them that go about 30 degrees, and those are semi-reclining. So you can also use these for pressure relief. So if you have a spinal cord injury or anything like that, you'll have some type of reclining wheelchair so that they can get off, you know, ischial tuberosity or sacrum and have pressure relief with that. On back of this reclining wheelchair, you're going to see an anti-tipping device. And so if for some reason it needs to be tipped, it's going to stop them from going completely backward. You'll also see on some of them, like this standard, show you, this is actually a tipping device. We use this to tip the chair backward if you have to get them over a threshold or up a curb or anything like that. Turn that on.